Welcome. Welcome all of you. Welcome. I welcome you all in this interesting video session. I welcome you all. Myself is Professor Dr. Rajendra Raghuveer Deshpande. I welcome you in this interesting video regarding the vertigo. Presented by myself, Professor Dr. Rajendra Raghuveer Deshpande. I am MD in Ayurvedic Medicine and MD in Ayurvedic Physiology. This is my personal website, ayurvedicfriend.com. This is my WhatsApp number, 922681060. And this is my mail ID, professordeshpande@gmail.com. Let us make the screen bigger so that it is more interesting to see the screen. Yes. Okay, mail ID is given for there are lot of fans of Professor Deshpande. They are not only from Ayurveda, they are from allopathy, homeopathy, pharmacy, physiotherapy, from all fraternity of health related aspect. And they are students. I am always thankful to all my subscribers. They are students, they are teachers, they are doctors, they are the common man, and they are the well-wishers of Ayurveda. So anybody can contact me for online medical consultations, online health counseling by adjusting your lifestyle as per your biotype. I also do the palmistry, don't forget. You can consult me with regards to the palmistry. I take online classes of the Ayurvedic and modern students. Now, we are talking about vertigo. So, vertigo or any health problem, if allopathy, Ayurveda, homeopathic doctor wants to treat, Professor Deshpande suggests that we all must find the root cause of the problem. Dr. Deshpande don't agree with the hitting in the bush or hitting in the dark. No, no, no. You should be very precise what you are talking about, what you are treating. So this is called as a differential diagnosis. In Ayurveda, it is called as Vyadhi Vyavachedak Nidana. Don't forget this word, Vyadhi Vyavacheda Nidana. Also, Dr. Deshpande always appeal to the Ayurvedic, allopathic, homeopathic, naturopathic doctors. My dear friends, what is the principal management? Sankhepataha Kriya Yogo Nidana Parivarjanam. This is in Devanagari script. This is in English. And what is the meaning? Management principle. It is not only for Ayurveda. Management principle for everybody. Try to avoid, try to remove, and try to treat the causative factors of vertigo. Try to treat the cause, and then automatically vertigo will go. I know sometimes we have to treat symptomatically, but symptomatically treatment is not the final answer. You must go for the cause. Now, here you can see the very interesting word, medical urgencies in nervous system. Medical urgencies in nervous system in our GP. So there are vertigo cases may complain that I am feeling vertigo. Syncope, murcha. This is Brahma in Ayurveda. Please see this video up to the end. Why? Because after some allopathic information, Dr. Rajendra Deshpande always adds Ayurvedic aspect and Ayurvedic management. This is very interesting, holistic approach. But in this, after completing vertigo, I am talking about one interesting more point. So when vertigo will finish, don't run away from this video. There is some another small interesting topic. I will not declare right now. So go to the end. Syncope, murcha in Ayurveda, anaphylactic shock. This is a severe form of allergy, anaphylactic shock. After giving injection penicillin, antibiotic, after giving injection neurobion or polybion, which contains B1, B6 and B12. But in this, B1 is very, very, very dangerous, thymine. It can cause this anaphylactic shock or reaction. Then injection interferon, injection for anemia. So this type of injections should be tested first in a small dose and then full dose is given. That is called as AST, after sensitivity test, or ATD, after test dose. What is the importance of anaphylactic shock? Shock is a less blood supply to the brain. Shock. What is shock? There are different types of shock, but shock means less blood supply to brain, mendu, mastishka. Anaphylactic shock is such a dangerous situation. It can be fatal sometimes. Fatal. Patient can die on spot. After you remove the injection needle, patient has lost his pulse and BP and everything. That is dangerous. Convulsions and epilepsy. Epilepsy has convulsions, but convulsions can be caused by different reasons. Today we are concentrating on vertigo. 1 minute please. You must see this word, urgency. Another word, emergency. Urgency, emergency. Urgency, emergency. What is the difference? For both, in Ayurveda, it is called as Atyaika Avastha. In the examination, there is always question. Tamaka Shwas Vyadhi Varnan Karun, describe Tamaka Shwas and explain Atyaika Chikitsa. Atyaika means emergency. Urgency is also Atyaika Chikitsa or Atyaika Avastha, and emergency is also Atyaika Avastha. So what is the difference? Write down, very important. Urgencies are many times can be treated and patient can be saved for his life. So it is not all the time fatal. If it is treated properly, of course, the symptoms are very serious. Patient is in troublesome, but it is not 100% fatal. But emergency is as good as fatal. Emergency is as good. So emergency patient should be admitted in the hospital immediately. Emergency cases should be admitted in the hospital immediately by calling 108 ambulance in Maharashtra state, India. But in urgency, if the doctor has done already completed EMS courses, emergency management in Ruby Hall in Pune or Aditya Birla in Pune, Symbiosis in Pune, then these people, this confident doctor can treat urgencies if they have the day care unit, 1 room special with bed. Then they can treat in the GP only, not necessary to admit. But emergency should be admitted. I hope I have explained another word, urgency and emergency. See the pictures. Vertigo. This patient is himself like losing his balance. Vertigo means unsteadiness because of the problem in the brain or problem in the ear. Vertigo, vertigo. Here, the patient can feel that he himself unsteady and getting fall off. But another type of vertigo, here the person feels himself stable, but around objects, like for example, tree. The tree is moving around his eyes, around his brain. Here in this picture, patient himself is unsteady and losing his balance. Here the patient may be steady, but around objects are moving. So these are two types of vertigo. Even according to Ayurveda, this is Vataja Brahma and this is Pittaja Brahma. We are discussing afterwards. What is the situation complaining of CO? Abrupt onset, acute, not for years. Immediately has started vertigo. From today morning, that doctor, I am feeling unsteady. I am feeling unsteady. This is vertigo. Patient has to lie down because otherwise he feels himself that he will fall down. That's why he has to lie down on the bed. There may be nausea and vomiting. Sometimes there may be tinnitus, ringing sound in the ear, tinnitus, nystagmus, movement of the eyeball, nystagmus, and sometimes there may be hearing loss. So these are the clinical features, complaints of the patient. There are two types, peripheral vertigo and central vertigo. Peripheral vertigo, pathology is internal ear. Peripheral vertigo, pathology in the internal ear, external ear, middle ear, internal ear. Inside the tympanic membrane, we cannot see. Central, pathology in the brain. Central vertigo, pathology in the brain. Peripheral vertigo is common. Again, the causes, Meniere's disease. Name of the scientist, Meniere's disease. Vestibular neuronitis. ITIS means inflammation. Inflammation of vestibular nerve. Benign paroxysmal postural vertigo. Benign, safe, no danger. Paroxysmal, intermittent, postural. When he get up from the bed, immediately feels vertigo. From sitting to standing, from lying down to sitting, change in the posture causes vertigo. That is benign BPPV. BPPV. Benign paroxysmal postural vertigo. Then last cause is little bit tumor, acoustic neuroma. OMA, OMA. OMA means tumor. OMA. Meniere's disease. What are the clinical features? There is vertigo, number one. Tinnitus, ringing sound in the ear. Ear. You hear some sound which is not there. So Ayurveda, it is called as a Karnakshveda. Write down. For tinnitus, Karnakshveda. Badhirya, deafness. Vertigo, Brahma. Brahma, Karnakshveda and Badhirya. If three together, then it is Meniere's disease. With nausea and vomiting. Nausea is a feeling of vomiting. Attack remains for few minutes, 5-10 minutes or few days even. Attack can recur again and again. Every attack, there will be progressive deafness. Gradually deafness will increase. Tinnitus, ringing sound, may be continuous or may be only during attack, only during episode. Next disease, vestibular neuronitis. This vertigo follows URTI, upper respiratory tract infection. First, there may be rhinitis, watering from the nose, cold and cough. CCF in GP. You remember? CCF in heart disease is different. CCF in GP. Cold, cough, fever. CCF. Cold, cough, fever. This is GP. And what is in heart disease? CCF. Congestive, cardiac failure. That is different word. So this URTI is CCF in GP. Cold, cough, fever, rhinitis, sinusitis, pharyngitis, laryngitis, upper bronchitis. This is upper. Huh? Then viral infection of vestibular nerve. No cochlear symptoms like deafness or tinnitus. So deafness and tinnitus will not be there. Self-limiting disease, automatic will go, and no recurrence. Once or twice in a life, once or twice in a year, that's it. With this URTI. If recurrence occur, always milder and milder and milder. Mild, not serious. B. Benign, paroxysmal, postural vertigo. Momentary vertigo, only few seconds, arises only when head is placed in certain critical position. All of a sudden I am looking over them. Immediately I will get rotation. So a typical position of your head, when you move your head in a typical critical position, this vertigo will occur. No cochlear symptoms like no tinnitus, no sound, no deafness. Advice: systematic, regular exercises to improve the muscle tone of neck muscle. Neck muscle. No hichki. No all of a sudden. No shock. But you can exercise. Simple. For example, 1, 2, 3, 4. Very slowly, very slowly. 1, 2, 3, 4. This type of exercises you must do when there is no attack. Don't do this rotation movement. Don't do rotation movement. That is not visible. Only up and down and lateral and this right and left lateral. That's it. This is exercises. My video is there on the YouTube. My dear friends, Dr. Deshpande, he has a YouTube channel, educational, pure educational channel, not chunky funky 5-10 minutes video, purely ethical videos with proper knowledge, with lot of action, intelligence, experience. There is videos regarding yoga. Dr. Deshpande, myself, has done yoga exercises 1, 2, 3, 4. 4 videos are there. You can look all those exercises how I taught on this channel. Nearly 550 videos are there. So you must check my playlist. Playlist is always important to search your appropriate video. Acoustic neuroma. Next disease for the vertigo problem. Neurofibroma arising from 8th cranial nerve, that is vestibulocochlear nerve, may or may not be accompanied with generalized symptoms. Neurofibromatosis, von Reckling-Havensen's disease. All small nodules all over the body. There is neurofibromatosis. This with that acoustic neuroma problem can be arise. You have to do the MRI. Okay, next. Symptomatic treatment of peripheral vertigo. Number 1, absolute bed rest. Relax. Don't move here and there. Don't drive the car. Don't drive the scooter, vehicle. No. Not working in the near fire. Not working in the water. No. Relax. Sleep at home. In acute attack, injection Phenargan 25 to 50 milligram intramuscular. Injection or tablet Stimatil 12.5 milligram 2 times in a day. This Stimatil tablet can cause extrapyramidal symptoms. Not for everybody. Extrapyramidal symptoms. For example, if patient is lying, involuntary movement of neck. He is lying and then automatically, if the patient is doing these involuntary movements, that may be side effect extrapyramidal symptoms. Tablet diazepam or injection diazepam is antidote for extrapyramidal symptom, which is a side effect of stimatil or sequel. Sequel tablet is also given for the vomiting. That also can cause extrapyramidal symptoms. And what you have to do? Give injection diazepam 1 cc or 2 cc intramuscular. The patient will go to sleep. Extrapyramidal symptoms will go. Don't worry. Symptomatic treatment of vertigo, labyrinthine sedative. Pharmacological name, labyrinthine sedative, tablet marzine or tablet gravol or tablet stugeron. Marzine or gravol or stugeron, 25 to 50 milligram 3 times in a day, morning, afternoon, evening. Vasodilator, tablet Vertin, very popular, 8 milligram 3 times in a day. Tablet Vertin for vertigo, Vertin for vertigo, Vertin for vertigo. Note, after acute attack is over, please consult ENT surgeon at least once to resolve our basic cause, because if basic cause you don't find, then that is a problem. Of course, you treat symptomatically, but then afterwards, after attack over, send to the ENT surgeon. Okay. Vertigo medicines. This is Phenergan injection, 25 milligram per ml. This is vial. Ampules are also available. Beta histine tablet. Beta histine. This is generic name. This is a trade name, brand name. Beta histine is a generic name. 8 milligram tablet are available. Vertigo, Ayurvedic aspect. Vertigo is called as a Brahma in Ayurveda. Hallucination is not real. Hallucination of motion. Surroundings are going around. Like you see the picture. Just moment. See the picture. Surrounding. Trees are moving. This is Pittaja Brahma. This is Vataja Brahma. Okay. Let us once again go there. No problem. Relax. Patient himself is rotating. That is Vataja Brahma. So you must differentiate. Ask the patient. How do you feel? Whether you feel that your self is falling down or the objects around you are moving. What is that? That is Pittaja Brahma, Vataja Brahma. Pittaja Brahma. Special precaution should be taken by Pitta or Pitta Vata Prakruti biotype. Everybody should try to know his own Prakruti or biotype. If you are lover, if you are interested in Ayurveda, it is your duty. Each person in the world that they must go to the nearby family Vaidya, Ayurvedic doctor, or Mahuna. Dr. Deshpande is there. So we can determine your Prakruti by sending you Google form by mail. And then we can also advise you about lifestyle, how you should behave. We send you the different pages, photographs, and there all the things are written. What type of food you should take, what kind of behaviors you should take, what type of occupation you should do, everything, what type of tonics you can take, in which diseases you are prone for, everything we advise based on the Prakriti. So Pitta and Pitta Vata, Prakriti are prone for Pittaja Brahma. So avoid Pitta Prakopak, Ahar and Vihar. Ahara means food and Vihara means lifestyle. No pungent, no chili, no sour, no salty. very hot food or beverages, excessive tea and coffee. No, no, no. If there is vertigo, don't take it. No vices like alcohol and tobacco. No. Avoid exposure to the excessive heat like sunstroke, working near furnace, working near fire. Avoid, avoid, avoid. Less screen time. Screen. Looking all the time to the mobile, webinar, seminar, lectures, computer, mobile games, television, serials, daily soap. No. Limited is okay. Excess is always bad. Not keeping late at night, going to the bed at 12, 1 at midnight, 2 at early morning. Are baap. No, 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 no. Early to bed, early to wake up is the secret of health. Remember, avoid night duties as far as possible. Change the duty for 1 week. Give the certificate of doctor that this is suffering from vertigo. I want change of the duty. Learn stress management techniques. Control your anger, ego, excessive ambition, jealousy. Why you are surprised? Why you are surprised? Ayurveda believes that mental things also affect your body. Body and mind together, always. Don't forget this. Don't forget. Ayurveda says, if you consider the health as a coin, on one side, you should be careful about physical aspect, and another side, mental aspect. They are the two sides of one coin, body and mind. So body, mind, machine should be taken care of. Check whether your bowels open regularly. Stools should be normal. No constipation. Constipation will increase Brahma. Vertigo will increase definitely. This is pranavayu. Remember. Pranotra murdhagaha. There are 5 types of vata dosha according to Ayurveda. Prana, udana, vyana, saman and apan. And every vayu has its specific rhythm of anuloma gati, proper direction. Apana vayu is lower abdomen. Gati, movement, impulse on the downward direction. If that impulse is obstructed, what will happen? Naturally, back pressure will be there. So for vertigo, you should have the normal stools every day morning. If you are having loose motions, if you are having the constipation, get it treated. In addition to the Vertin, Phenargan, etc. Pittaja Brahma treatment, mild laxative, avipattikara churna vati. Nowadays, it is very good. Many patients don't like to take churnas or the powders of Ayurveda. That is called as the compliance of the patient is not there. So they can have the tablet, because tablets are also available in the market. Avipattikara churna vati. Vati means tablet. 2 tablets at night for getting normal stools in the morning. Mild laxative, no loose motions. Shiro pichu. Cotton and bandage swab soaking in the Mahanarayana oil. Put it over here and keep the bandage like this. 5-6 hours you can keep Shiro Pichu, head swab soaked in Mahanarayana oil. Oil means tail. Walking on green grass in the evening. This is Pittaja Brahma we are treating. Application of Shadda Dhauta Ghrita. Ghrita means Ghrita means ghee, but Shatadauta Ghrita is a medicated ghee for external application in Pittaja Vyadhi. Apply this with the copper vessel to the feet at night, plantar region. And then gentle bandage. Otherwise, this Shatadauta Ghrita can damage your bed sheets and clothes. So be careful. Black staining will be there. Tablet Mauktik Kamadudha. Mauktik means pearl. Very, very cool. Cool, cool, thanda, 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 cool, cool, Muktik Kamaduda. It's little bit costly. I know. 1 BD plus Praval Pishti Vati, 2 BD, 2 tablets in the morning, 2 tablets in the evening with milk as a Anupan. Anupan is a vehicle or carrier for taking the medicines. Tablet Sutta Shekhar. If the Pitta is a Samapitta, Pitta with indigestion, Pitta with constipation, Pitta with gas in the stomach, that is Samapitta. Sutta Shekhar is for Samapitta only. Sutta Shekhar for hypertension, because hypertension is a Samapitta. Pittavrutavat, hypertension. Hypertension, Pittavrutavat. Vata movements are obstructed because of the Pitta dosha. There you can use the Sutta Shekhar. After breakfast with Gulkand. Gulkand is a rose petal jam. Pictures are always best. Sutta Shekhar Ras Suvarnakalpa by Dhuta Papeshwar Company. Very interesting, very best company as per my opinion. Baidyanath is also very standard for herbo mineral compounds. Kamadudaras with Muktik. Can you see Muktik? Now next type Vataja Brahma. Vata dosha. Vata dosha prakop is many times with the two problems. Dhatukshejanya vata prakop and Margavarodhajanya vata prakop. Vata prakop, vata vitiation, always because of the two problems. One is Dhatukshejanya, that is deficiency disorders. Protein deficiency, carbohydrate deficiency, fat deficiency, vitamins deficiency, mineral deficiency, water deficiency, dhatu kshaya janya vata prakop. And second, obstruction, margavarodha janya vata prakop. Many times vataja brahma is because of dhatu kshaya vata prakop. Patient is very weak. He may be anemic, hemoglobin less than 10. He may be low weight person. Height and weight chart. Weight is very low because of cancer, because of the HIV, because of tuberculosis. Weight loss may be there. Fat loss may be there. Bone loss may be there. Ojakshaya may be there. So that is Vataja Brahma. Caution. Who should be try to prevent from this Brahma? Vata and Vata Pitta Prakriti people. Avoid Vata Prakopak. Ayurvedic terminology. If you love Ayurveda, try to learn Ayurvedic terminology little. Vata Prakopak, Ahar and Vihar. Avoid too spicy, too bitter and too much astringent food stuff. No fasting. Of course, it may be religious or maybe to lose your weight, which is called as a drastic diet plan, should be avoided. 2 or 3 times you should eat fresh, warm and nutritious food. Avoid too much physical or mental strain. That also can make Vata Prakop. Treatment for Vataja Brahma, full body, gentle massage, not strong massage, gentle pleasing massage with nutritious oil, that is Dhanvantaram Kujambu. Dhanvantaram Kujambu. Please write down what is the meaning of Kujambu. These are all from the South India pharmaceutical companies. Ayurvedic Shala Kottakal. I used it very much. Ayurved Rasashala Kottakal. Then AVN, Aryavaidya Nilaya. There are a lot of MAA, Malabar Hill. So lot of South Indian pharmaceutical companies, they prepare excellent oils. Believe on me. Believe on me, because myself, Dr. Deshpande, has worked from 1994. I'm sorry, I think, yes, 1993 to 2014. 20 years I visited America, Switzerland, Germany, Italy, Spain. Still I am running the health center in the Spain, where we are using the oils from South Indian companies. Very, very good. They really, really genuine. So Kujambu means which contain oil plus ghee. So oil and ghee together in the oil is called as Kujambu. Pratimarshanasya. Because Brahma is related with the brain and ear. So all the Urdhva Jatrugata Vyadhi. Very interesting term. Urdhva Jatrugata Vyadhi. Jatru means clavicle. Jatru means clavicle bone, collar bone. The part, organs above this neck region, in Ayurveda they are called as a Urdhva Jatrugata. Urdhva means up, head, ENT, and ophthalm, eye. For any of these things, you can have the treatment like air hinge, nasya, putting the oil drops in the nose, like this, nasya, pratimarsha, very small dose of oil with kshira bala oil, only 2 drops in the right nostril, 2 drops in the left nostril, finish. Yapana basti. Basti is the best treatment for Vata dosha. Yapana basti is nourishing the basti for Dhatu Kshaya Janya Vata Prakop. Lekhana basti for Margavarodha Janya Vata Prakop. Yapana basti for Dhatu Kshaya Janya Vata Prakop. Please write it down. My dear friend, educational video. Ashwagandha Churnavati. Ashwagandha Di Churnavati. Can you see? Di, Adi. Adi means etc. Ashwagandha, Guduchi, Shatavari, and Gokshura. 4 important immune boosting, Oja Vardhak herbs, plants. And they are there. This is also called as Rasayana Churnavati. Ashwagandhadi Churnavati, 2 tablets, plus very nourishing tablet Makara Dhvajavati, 1 tablet BD with Ashwagandharishta, Withania somnifera. Shatavari Kalpa, 2 TSF with milk 2 times in a day. Pictorial, gentle soothing massage for Vataja Brahma. Dhuta Papeshwar, Makar Dhvaja Gutika, this is also gold product, gold, Suvarna, Ojo Vardhana, Oja. Oja is immunity in Ayurveda, Oja, essence of all the tissues. Now Brahma and related diseases, you must think of Pittadhikya. In body, there may be excessive heat, then Brahma can be occur. Raktadab Vruddhi, hypertension, Madhumeha, diabetes mellitus. Hypoglycemia also calls vertigo. Pandu, anemia, hemoglobin less than 10 gram %. Brain tumor, very cautious. Heat problem, heart problem, heat and heart both. Avastha, Brahma, there may be Samavastha, there may be Niramavastha. Chikitsa, symptomatic, Shamana Chikitsa, Bruhana Chikitsa, Nidrakar, anxiolytic, Raktavardhak, and Balya. Treatment with different causes. Brahma is associated with keeping late at night, late dinner, mental stress, irregular meals, excessive exposure to the heat, and then there is a Brahma. What medicine? Laghu Sutta Shekhara. 3 tablets stat and then 2 tablets morning, afternoon, evening. Brahma, but there exposure to the hot sun, excessive heat, near the fire, near the furnace, chemical factories, night duties, excessive physical and mental stress, and Brahma. And Brahma. Then what medicines? Laghu Suta Shekhar, 3 tablet. Praval Pishtivati, 3 tablet. Kamadudhavati, 3 tablet. 3 plus 3 plus 3. Yes. Yes. Then BD, morning and in the evening, after lunch, after dinner. You have to take, then Brahma will go. But here, disclaimer. Dr. Deshpande is warning here. Attention! These all videos are for educational purpose only, for students, doctors and teachers. For the common man, just to improve their general knowledge, but not for self-medication. Dr. Deshpande never in any video, although he is forget to tell, but remember this statement. Dr. Deshpande will not advise you to do the self-medication. This is unethical. So this is for your general knowledge. If you want to take any single medicine, please consult nearby Vaidya or Mahuna. Dr. Deshpande is there, so you can consult with me, no problem. Low BP is there, cervical spondylosis, less blood supply to the brain, Chandra Kalaras, 2 tablets. Suvarna Makshikadivati, 2 tablets. Laghu Suta Shekhar, 2 tablets. Lakshadi Gugul, 2 tablets. Gokshuradi Gugul, 2 tablets. Yes. I know. This much tablet the person cannot take single. So break the tablets. 2 tablets, for example, at 8 a.m. Another 2 tablets, 10 a.m. And this is not for lifelong. Only 1, 2, 3 days, finish. This is symptomatic treatment. Try to understand. But if you take this, doctor gives this tablet to you, Brahma will go definitely. Then tablet Prashama Ayurveda Shishala Pune. Doctor can select 1, 2, 3 tablets or all the tablets as per his own intelligence. But this is for you people guidelines. Go in this direction. At least you know some tablets which Dr. Deshpande has already experienced, and then he is telling to you. Believe on me. Then Kushmanda Pak. If patient is very weak, low weight person, weak person, then give the Kushmanda Pak 2 TSF BD. This is very good rasayan. Brahma with hyperglycemia, blood sugar more than 300, more than 500, more than or nearly 1000 milligram per 100 ml. Hyperglycemia. Then tablet DBT. Believe on me. Dr. Deshpande has done the research on this Sharandhar Pharmaceuticals tablet, which is called as a DBT. I found it best tablet to control the blood sugar in Madhumeha. Try it. My dear student, my dear teachers, my dear doctors, try it. But remember, you must take the pre-blood sugar, post-blood sugar by the glucometer. Even you can try with oral hypoglycemic agents, Restinon, Viclide, anything. Then you start this. And gradually, modern allopathic medicines can be reduced. Even the dose of insulin can be reduced. I am sure about it. Because I have done the research on this tablet DBT. Tablet Chandraprabha, 2 tablets. Arogyavardhini, 2 tablets. Plus Rasayana Churna. That is Ashwagandhadi Churnavati. All these are for guidelines. If there is hypoglycemia, opposite. Don't use DBT. Don't use DBT. You use the Glucon-D powder, 1 TSF with water, then Shatavari Kalpa, 1 TSF with milk, 3 times in a day. If there is a hypertension and Brahma, Arogyavardhini 2 tablets. Best medicine for hypertension, Arogyavardhini is not only for liver, For hypertension, because hypertension is pitta vrutavat, pitta vrutavat, and we have to take out the pitta and ushnata. Arogyavardhini, there is a Kutaki plant. Write down. Picrorhiza kuro. Latin name. Picrorhiza kuro. Arogyavardhini. Kutaki. Tamra bhasma. Then it reduces the heat, reduces the pitta through the stools. Best medicine. Arogyavardhini for 6 months, 1 year. It will not give results in 2 days. No, no, no. In 3 days, hypertension will not come down. No. I am telling you, if your patient is resistant hypertension, try it Arogyavardhini for 6 months. Tell me after 6 months, why we are in a hurry? Huh? You are there, I am here, no problem. Gokshuradi Gugulu, 2 tablets. Shrunga Bhasmavati. Shrunga Bhasmavati, animal product, 2 tablets. And Swarnamakshikadi Vati, 2 tablets with Dhamasa Kadha. Dhamasa, best medicine for hypertension, best herb for hypertension, home remedy for Dhamasa Ghanavati. Dhamasa Ghanavati for hypertension. If there is anemia and weakness and Brahma, Shrunga Bhasmavati 2 tablets plus Chandraprabha 2 tablets plus Swarnamakshikadi Vati 2 tablets with Gorakh Chinsavale for anemia. Best. Gorakh Chinsavale. Many my viewers tell, Dr. Deshpande, your lectures are so fantastic because we get ready-made knowledge for our medical practice. Lot of people, MBBS doctors, they write me. BMS doctors who are practicing. Just yesterday, there was one person, I think Dr. Wankhede from Buldhana district. He said to me, he write WhatsApp to me, Dr. Deshpande, I am follower of your YouTube. I am a subscriber. I am a fan. Thank you very much, sir. I practiced allopathy for 20 years, but now I want to start Ayurveda because of you. I want to start Ayurvedic practice, but sir, please guide us in between. I said, no problem. Best of luck, start practice. So my dear friends, practice Ayurveda, no problem. Practice it. Start, understand your merits, understand your limitations, and do it practice, no problem. So, but at least you must try, in spite of only blaming, oh, there is no effects, how we can treat Ayurveda. You try at least, and then talk about that. Gorakh Chinsavale, you never heard about this Gorakh Chinsavale for anemia. But I am telling Gorakh Chinsavale for anemia. In Pune, I used it from Khadiwale Vaidya. One interesting, very, very guru of mine. Vaidya Ego Joshi sir is my guru. Vaidya Subhash Ranade is my guru. Vaidya Khadiwale Vaidya Paya senior was my guru. He is no more. Khadiwale Vaidya in Pune. Raman Bhagashala. Hari Parashurama Aushadhalaya. Hari Parashurama Aushadhalaya Khadiwale Vaidya. He has that Gorakh Chinsavale. Fantastic. Then Kushmanda Pak for weakness. 2 TSF in the morning. Nearly end of the topic. Always management with Ahar Vihar Aushadhi, that is diet, lifestyle and medicine. But with your permission, only 5 minutes, a simple small topic I will take. I will go back slowly. Can you see? I am going back. I am going back. Just wait. Just wait. My dear friends, don't leave. Don't leave. Yes, 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 yes. I want to give some information about very fresh topic. New topic. This is new. Hangover due to alcohol. Abhi to party baki hai. Whole night, lot drinking, alcohol party after dinner, liquor party. Complaining of headache on the next day bar. After drinking the alcohol, next day he has a lot of headache. So simple symptomatic treatment, paracetamol or crocin, acetaminophen, 1 tablet, BD or TDS or as per requirement to control symptomatic. This is analgesic. To control that hangover, symptomatic treatment, black coffee with roasted toast. He should drink black coffee with roasted toast. Another remedy, honey with lemon juice. Either or is not all the he has to take. Crocin, every headache you can take the crocin, but black coffee he can take or honey with lemon juice he can take. Then eat enough. So after eating, after getting food, he will reduce the gastritis due to the alcohol. We are talking about hangover due to alcohol. That can also cause the vertigo. But vertigo, I have finished. And now I am talking about hangover due to alcohol. Drink plenty of water. Because why? Reason is important. Alcohol can cause dehydration. So the person must drink enough water because alcohol can cause dehydration. If we want to prevent this hangover problem of the alcohol, then what is the advice? At least don't take cocktail, mixture of different alcohols. Don't take any time. Forget about cocktail. A cocktail is not for you. Of course, I am saying, Dr. Deshpande is telling you, please don't take any alcohol. Why to take alcohol? No. De-addiction program. But if at all you are not, still you are in that phase and you are taking limited, don't take cocktail. Drink after meal if you want to take alcohol. Don't drink alcohol on empty stomach. Never, never, never. Don't drink alcohol on empty stomach. Don't drink alcohol when you are doing fasting. Don't drink alcohol when you are doing dieting. No. Maximum 1 to 2 small. Dr. Deshpande is not recommending to take the alcohol. No, 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 no. Just it's a compromise that I am saying like that. Then how to adjust? Drink sip by sip. Not like fast drinking. Very, very, very gentle, soft and very small sip. One small cup for 1 hour. That cannot do the hangover due to alcohol. So today, Dr. Deshpande, here one thing I can add. Even you do the anti-pitta treatment according to Ayurveda. Anti-pitta. Mauktik Kamadudha is the best medicine. Write down. Although it is costly, the patient can spend in alcohol, he can give you also the money. Give the tablets. Mauktik Kamadudha. 2 tablets. Heavy dose. Heavy medicine, very good medicine. Mauktik Kamadudha 3 times in a day. Mauktik Kamadudha 3 times in a day, and Shatavari Kalpa 1 spoon with 1 cup of milk 3 times in a day with this liquid. Mauktik Kamadudha orally, and then Shatavari milk. Very good for the hangover due to alcohol. So today in this video, Dr. Deshpande has covered 2 interesting topics. Number 1, vertigo, and number 2, hangover due to alcohol. So end of everything, and I wish you all the best. Disclaimer, Dr. Deshpande's videos are for educational purpose only. No self-medication. If anybody does that mischief, he or she will be responsible, and Dr. Deshpande is not responsible. My kind request at all the time, subscribe my all these videos to your friends through WhatsApp link. You send the link, you send the mails, and tell you are the health ambassador. So tell them that please subscribe Dr. Deshpande's YouTube channel. He is doing very nice job. And my dear friend, all the time my best wishes are with you. I wish you happy, healthy, and a long life. Not only long life, happy, healthy, long life. Thank you very much. Take care. I am closing this video and saying bye-bye to you. Bye. Bye-bye.